process and the flow from their appointment to getting their notes and labs and everything ordered. I'm starting off on the calendar screen here. Today's my admin day, but you can see I've put my test client in for an appointment. I could click directly on that, or I could come up to the top bar that says my schedule and click on it there. So when she starts her appointment, she is going to get a button to start the session. And this is an example of a televisit that we are using the Practice Better system. I was using Zoom and it kept wanting me to update every time. And so the other day I switched it back to the Practice Better. Here's an example when I press that of how the session's going to come up for me and her. And then we have the next tab, add session notes, edit the visit. So let's say she can't make it and I want to reschedule it. And if I want to add anything, notes, send any forms that weren't automated. So first thing before this visit, I might want to review her forms. So I'm going to click her little icon to go to her portal. This is my test client. And this little pop-up lets me go down to forms, and let's see what forms she's filled out. So I can see that these most recent forms she has not filled out. I could cancel the request because, for example, this is a duplicated form here, so I could cancel that. And I could see she did fill out an intake form from a prior booking, and I can press annotate to view that. And then I might want to pull this up so I'm going to duplicate that into another tab because I'm going to be using her intake form during her visit. I personally have mine set up into pages down here. So I would click next page to get to the test client is my cat. So you can see some of her history here. So I'm going to leave her intake form up in that, and then I'm going to go back to, in this other tab, I'm going to go back. I can also show you the MSQ form. This is a popular one for doing symptom review and remeasuring it throughout their progress. You can do journals and disclaimers. All of that's going to be in forms. Okay, so we've got her form pulled up. So now I'm going to start her visit. Let's go back to now she's arrived on her session, and I'm going to click Add Session Notes. Okay, now I'm going to choose one of my templates. So I'm going to choose Holistic Matrix for her intake. And here you can see a template that I already have set up that pops up. And under this matrix, I built these as tables. So I could go in here to surgical history, and I could put that abscess, I can't even spell, abscess drained in 2020. And so this is how you start to fill in some of her history if you would like. And you can have all kinds of, this is, for example, another type of box, highest priority us, highest priority her, plans to work together, going through packages. You can make whatever you want. This, for me, is kind of a running care plan between practitioners. I'm editing it and working on it, but it's something that that has worked well for me. So I'm going to go ahead and press save for that one. And I'm going to show you a second note that I create at their second visit. So I need to go out of this was her session for today. I'm going to go to her main, let's go to notes again. And let me just create a template for her intake and show you, not the intake. So after the televisit intake, the next session is the in-person consultation. And this visit note, I have it automatically pull in some things. Well, she doesn't have a lot in her intake form, so there's not a lot pulled in here, but you can automate it to be pulling in, her family history. This doesn't demonstrate much being pulled in. But this history that you automate to come into your notes, you can also automate to go into her different sections like basic information, medical history. So let me just cancel that. So let's go to medical history, and it would sync in here based on how I've coded it. You can also add diagnosis codes in medical history if you want these things to, let's say vitamin D deficiency. We're going to tag that there. And diet and lifestyle. You do have to save changes in each of these sections. Diet and lifestyle will automate some of the things that you pull over. And basic information, this is where it's going to pull over the things she wrote in with her contact. It should have insurance if she'd filled it out. I will show you for insurance. I have them fill out a specific insurance form, which is not in here, but I have a form specifically for insurance that just notifies them that I am not in network, but I will put their insurance information on labs. So while we're in this view, let's look at let's go back to the notes tab. But in this view, which is mostly what you're working with in the client's portal when you're with them, I, during her visit, may be going between notes, protocols, forms, and labs. Okay, maybe she had uploaded some prior labs, and that would be down here in her documents. And I'd say, oh, I see you uploaded, I can review those labs you uploaded. And okay, so now we've opened up this visit here. This is the note for today's visit, and I can be working in this. I can add text. I can link labs. So let's say I want to add a section, and I want to add usually you're just going to add text and put something there. Now I'm going to have you look at the top here again. You saw under that fast action that you could link a lab, link a protocol. You can also do it at the top here. You can link a document you want her to have access to, protocols, labs, and tasks. Okay, so in order to link it here, this is simply so it looks like it's attached. We have to actually go out and create those under the sections. Okay, so for a protocol, let's say today I'm going to go fast action protocol for, this is my kind of annual exam template, which has some little tips and then some recommendations that I've saved in here, some common supplements, which it's really easy to delete them. So let's say like I have a multivitamin, I also have a prenatal. So of course, like, if she's not interested in getting pregnant, I'm just going to delete this one so she's getting the regular multivitamin. And this one, I have some of these lifestyle recommendations built in. I went a little overboard because this was my first one I was creating. And there can be documents attached there. So now we're going to save this and publish this for her. I'm going to skip the notification right now. So this is going to create a Fullscript recommendation for these vitamins that have been released to her. It's going to email her from Fullscript. She can go there. She can order them. So now we have a protocol for her that we've put in today for her visit. And let's say I decide I'm going to go ahead and order some labs. And if I'm doing it through Quest, I need to go to Quest portal directly. I'm going to go to Quest, This is how I do it. I'm going to get into Quest. I have my pick list already in there. My virtual assistant has already entered my patients in there, and I'm going to order it, download the requisition. Okay, so we're not syncing between the lab portals, and the Quest and Labcorp do not sync directly. So my virtual assistant is a lot of help to get them entered in here. And then I went through the steps of setting up my pick lists in there. So it's really easy. My diagnosis codes, my favorite labs. And then I would create and say, functional blood panel. And I would say requisition ready. I would attach it and share it with her. And so if she, so she knows that she's ready to go to the lab, and I would create this under here, and you can see it says requisition ready. Now, when the results come back in, my virtual assistant downloads them. She comes in here, she edits it, gets rid of the requisition, attaches the results, changes it to results available, and then she goes into tasks and creates a task for me to review it. And then when I review it, I then come back into here, and it's a little, you click it like this. There's nothing attached here to review, but I would annotate it and write a note and say, your labs are blah, blah, blah. And then you can share all this with the client. So the client gets an email that the labs are there, your note is on there, and this is all going to be under her lab tab here. One unique feature of Practice Better is that you can order from Rupa directly, and I'm going to not go down that route, but let's say you wanted to use them for some functional labs or order the Dutch test. You can order it within the portal, and the results will sync that way. Okay, so now we have a protocol ordered, we have a lab ordered. Let's go back to our note that we're going to sign off on for today. So I've done her note. I'm good with it. I'm gonna share this with her by making this section visible. I might make this section visible, but no, I'm not going to make this one visible. This is more for my internal plan. So I'm not going to select to make that visible. So I can make this partially visible to her, and then I can click share notes with her. And when I close it, it's going to ask me to email her. Now let's go to the top section, documents. No, I'm not going to send any documents to her today. If I wanted to, I could link it there or upload it. Protocols. Now I did make her a protocol for today. This is the one for today, so I'm going to link it. I did do a lab, so I'm going to go link it to here. Let's say I want to do a task for me or her. So let's say, let's say she needs to upload your insurance card to documents. And I can set, due dates and stuff. But we can do that for her. And we can also add a task for me that says finish reviewing intake. Okay, so that's going to go to me. So now when I go to save this for her, I can either save the progress just because I'm not done. However, because I selected that share to the patient thing, it's going to ask me if I'm ready to share. Or I can press save and sign and save. So sign and save is how you're going to officially stamp this that you are done. And you see, because I had already put the about sharing it with her, so I can either normally would just do send confirmation, and I'm going to save and share. So she gets that email that I've shared her note. So she's going to get an email, I shared her note. She's going to get an email about that lab requisition being there. She's going to get an email from Fullscript that her recommendations are in Fullscript, and she can go there to check out and purchase the supplements. And on this form, you can see that I have attached this protocol and this lab when I'm reviewing my notes. And then we are finishing her visit, and we want to go ahead and book her next visit. So we're going to go up to bookings, and we're going to, she had a package because the second session is going to be the in-person visit. So I'm going to click on, so here today you can see we used the Televisit intake. The next session, we're going to click this one is what she needs to use next. I can look at my schedule, get her booked. Finally, you're going to make sure your invoice that you've made is either there for her emailed or paid, or you need to make her pay right now. Okay, so it does not automate an invoice unless you've created an automation for it to do that. And I do not have that automated, so you can see there's no invoice for today. I could create an invoice here, and I'm going to show you, let's say she bought some supplements. I have the supplements listed. So the supplements I have in person in the office, I already have them listed into my supplement inventory list. So when I click it, it brings up the price. I could add multiple things here. I could add a program. I could add, let's say she wanted to enroll in this program. We can do that. And then I can add my tax, which is a little bit of a manual process for tax. I mean, they're operating in Canada, the US, a lot of countries. But the way I do tax is at the end of the month, my virtual assistant runs the report for the months collected, the total sales of supplements that were taxed. I don't tax their visit, but she runs the report, finds out how much we billed, how much we collected in taxes, and then she logs into the state website, and it's already got my information. So I utilize the virtual assistant for multiple things. So this is how you create an invoice. When I go to process, I require their card to be saved on file when they do the initial part, and so I can easily pull their card. This is not, I don't have anything saved in my test client, but normally their card is sitting there, and I can say, do you want to use this card ending in 4246? And they say yes, and I just check it out. So it's pretty quick. You can alternatively email them the invoice rather than processing it. And I probably should not have just made her an invoice, because now it's going to be, let's go under billing and payments. And I probably need to delete this. Okay. So lastly, I just wanted to talk about what my virtual assistant does. I use a Filipino virtual assistant. She does a lot of things for my practice, but I do have her the day before I see clients. She reviews to make sure their forms are filled out. If not, she, emails or texts them. And that's, she's looking here to see if anything needs to be filled out. She puts them in the lab system for Quest or Labcorp based on the insurance form. And I can show you how I've done this, because people tend to not give you all the information on their card. So insurance info, this is, they have to select, yes, I have insurance. I want it billed for labs. No. So they select here, and I've already put this disclaimer that have how it works. This is a set form Practice Better has that makes it sync into their chart. This is their insurance form. But what I found was people were not filling, a lot of people skip the group ID, for example. So then, and also sometimes you can't figure out which plan it is. So I asked them, what state is the plan hosted in? Then please review. And, do you know if you need, I tell them I use Quest except for Blue Cross Blue Shield. Do you need Labcorp? And this just helps guide my virtual assistant to get them entered into Quest. So I can go do their order, or if I draw their blood, I can print off the requisition. And then she'll be attaching. The only thing she's doing after the visit, I have her make sure also that each of my clients has their telemessaging. Okay, so because I run some free group programs, I don't want to give everyone access to private chat. So I have it where I set a reminder for myself or my virtual assistant for any private clients to go enable direct chat access. So I could search for Lizzie and say, make sure it's checked so that she gets to direct chat me. Yeah, so that's what the virtual assistant helps me. That's kind of my flow going from, and I'll go back to the, well, I was going to show you the package that is kind of my steps of requiring. So the packages, so you have your services all listed here. The package that I've kind of settled as what I really like people to be doing that are just working with me as a practitioner is that they're starting off with an intake televisit, which is that kind of history and matrix and talking about priorities in care, and then a week later meeting with them in person. This is where you do your visit, consult, your assessments, and I might order labs before that visit or at that visit, or they have to go to the lab and get them. And then 2 weeks later, I have found it's really essential to have this follow-up visit to make sure that they have implemented the plan, ordered the supplements, decided on a date to start a diet. And, a lot of times you get really good feedback on the supplements, which is nice. And this works really well. So I'm adding a fee for it. It's really about 30 minutes that I end up talking to them. And if I have their basic Quest labs, I can review them over the televisit. And then I personally tend to schedule for 1 to 3 months later. I have another package that has health coaching in it. And this way I'm able to set, a rate. My current rate is practitioners are $195 an hour. And that is reflected in this. And then I'm able to show them that they're getting 30% off by, booking all of this together, which is essentially working together for, this is probably going to be a 4-month kind of thing, which means that their payment plan option that I give them, Advanced Options has a payment plan. And the payment plan, so because this on average is a 4-month working together, it's not too bad when they see it as a $150 deposit and then monthly as $112 for those 4 months. So I love that you can have these payment plans and basically require these patients who want to really deep dive health issues to book not just one visit, but all of this intake and establishment and lab review and virtual check-ins. And and it's a reasonable monthly payment when they have a payment plan. So that's kind of the flow that I've been using. I've been using this for about 2 years, and this is my newest flow and what I figured out works for me. And then, lastly, if they want a Superbill, oh Lord, I got to get back to Lizzie. Okay, my test client. Let's go to the Superbill, billing and payments. And up here under Superbills, up at the top, you can create a Superbill for today. And it does not have her insurance information in here because we didn't do it. But you can see that diagnosis code I had on her chart is there. And if I want to add another diagnosis code, the diagnosis code you have to add in her medical history. I thought you could manually add it here, but I'm not seeing it. Procedure code. So you need a CPT here. So let's say it's a new level, 5. And here's where you can add diagnosis codes. So let's say a 92, excessive bleeding. Let's add that. And now it's going to go up there. So you can add your diagnosis codes, your visit information, adjust anything with her, what she paid here. And then you're going to be able to email it to her, save and send, to create a Superbill. And if you are doing CMS forms, I don't do these. I will open it up and see what happens here. I don't know. I don't really know how that works. But I know from forums that people are using a third-party billing service. So this kind of gets some information to their biller, but there is no internal billing system. So it's nice that you can create this, but it's really built for cash pay, and it works well for me.